I want you to try something right now. If you're sitting down, stand up carefully. Find a wall or a sturdy piece of furniture nearby, just in case. Now, lift one foot off the ground and try to balance on the other leg. Don't hold on to anything. Just stand there and count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Could you do it? Could you make it all the way to 10 seconds without wobbling, grabbing for something, or putting your foot back down? If you couldn't, I need you to know something. This isn't just about your balance. This isn't just about your legs or your coordination. What researchers have discovered in the last decade about this single, simple test is something that should be in every doctor's office, on the front page of every health magazine, and in every conversation happening between adult children and their aging parents across this country. And yet, most people have never heard of it. Most people walk through their 60s, 70s, and 80s completely unaware that their ability or inability to stand on one leg for just 10 seconds is quietly predicting something far bigger than a fall. What it's actually predicting is your risk of dying within the next decade. Not someday, not abstractly. With a level of statistical accuracy that stunned the researchers who first published this finding and shocked the medical community that followed their work. A study published in the British Journal of Sports Medicine followed more than 1,700 adults between the ages of 51 and 75. They gave them all the same simple test. Stand on one leg, eyes open, for 10 seconds. The results were sobering. Nearly 1 in 5 of the participants couldn't do it. And when researchers tracked these same people over the following 7 years, those who had failed the test had an almost double the risk of dying from any cause compared to those who passed. Double. Not from falling specifically. Not from a single condition. From any cause. Heart disease, stroke, cancer, respiratory illness. The connection was there regardless of what eventually took their health. This test was measuring something deeper than balance. It was measuring the biological age of the body underneath. This is not a scare tactic. This is not something designed to make you feel hopeless or afraid. This is information. And information, when it comes early enough and when it's paired with the right response, is the most powerful health tool in the world. That's exactly why we're here today. Because you deserve to know this, and more importantly, you deserve to know what to do about it. Before we go any further, if you've found your way to this channel and this kind of honest, no-nonsense health content speaks to you, please take a moment to like this video and subscribe to Dr.Selric. We work hard to bring you research that matters, explained in a way that actually makes sense for real life. There are no gimmicks here. No miracle cures being sold, just real information that could genuinely change the quality and length of your life. Hit subscribe so you never miss what we share next. Now, let's get into everything you need to understand about this test, what it really measures, and what you can do starting today. Let's begin by talking about why this particular measurement, one leg, 10 seconds, tells us so much. Because on the surface, it seems almost too simple to matter. Surely your doctor has more sophisticated tools to measure your health, right? Blood panels, imaging, cardiac stress tests. And yes, all of those matter. But what the one-leg balance test captures is something those tests often miss entirely. It measures the integration of your entire nervous system, your muscular strength, your joint health, your inner ear function, and your brain's real-time ability to process sensory information and respond with physical coordination. That is an enormous amount of information compressed into a 10-second window. Think about what has to work perfectly for you to balance on one leg. Your eyes must send accurate spatial information to your brain. Your inner ear must communicate your head's position. The tiny sensory receptors in the muscles and tendons of your standing leg, called proprioceptors, must constantly send feedback about where your body is in space. Your cerebellum, the part of your brain responsible for movement and coordination, must process all of that simultaneously and make dozens of micro-adjustments per second. Your hip muscles, your ankle stabilizers, your core, your lower back, all of them must activate and hold in a dynamic, constantly shifting collaboration. When you can do all of that for 10 seconds, Your body is demonstrating a level of neurological and physical integration that researchers now recognize as a powerful marker of overall systemic health. When you can't, it suggests that somewhere in that chain of systems, something has begun to break down. And the systems that affect balance are the same systems that affect heart health, brain health, metabolic health, and longevity. Here is something that rarely gets mentioned in routine doctor's visits, and it matters enormously. The decline in balance begins earlier than most people expect. Research has consistently shown that measurable balance deterioration often starts in the mid-40s, not the 60s, not the 70s, the 40s. By the time most people reach 65, the decline has been going on quietly for 20 years. It's gradual enough that it doesn't feel dramatic from one year to the next. You adapt. You hold on to railings without thinking about it. You sit down to put your shoes on instead of standing. You avoid uneven terrain or cobblestone sidewalks. You choose the chair closest to the wall at a restaurant so you have something to grab if you need to stand up quickly. These little adaptations happen so naturally, so unconsciously, that most people don't recognize them as compensations for declining balance. They just feel like practical decisions, sensible choices. But each of those small accommodations is your body quietly telling you something about the state of your neurological and muscular health. Now here's where the story gets more personal and more urgent. Falls are the leading cause of injury-related death in Americans over 65. Every year, more than 3 million older adults are treated in emergency rooms for fall injuries. More than 800,000 of those hospitalizations are for head injuries or hip fractures. A hip fracture in an older adult is not a simple injury. Studies show that up to 30% of seniors who fracture a hip die within 12 months. Not because of the fracture itself, but because of the cascade of complications that follow. Immobility, blood clots, pneumonia, muscle loss, depression, the loss of independence, the psychological shock of sudden frailty. What begins as a single moment of lost balance can unravel years of carefully maintained health and independence in a way that is devastating for the person and for their entire family. And here is the part that breaks my heart every time I think about it. Many of those falls were preventable. Not because the person was being careless, not because they weren't paying attention, but because nobody had ever told them that their balance was declining in a measurable, addressable way. Nobody had given them a test. Nobody had said, your balance is already at a level that puts you at significant risk, and here is what we can do about it right now, before something happens. They were never warned. And that gap between what the research knows and what patients are told is exactly why conversations like this one matter so much. Let's talk about what poor balance is actually connected to beyond the risk of falls, because the list will likely surprise you. Declining balance has been strongly linked to reduced cardiovascular fitness and the early signs of arterial stiffness. The same loss of vascular flexibility that reduces blood flow efficiency in the heart and arteries also reduces the quality of blood flow to the nerves and muscles involved in balance and proprioception. This is why poor balance and cardiovascular disease so often travel together, not because one directly causes the other, but because they are both symptoms of the same underlying process, the systemic aging and deterioration of vascular and neurological health. Poor balance is also closely associated with cognitive decline. This connection is one of the most fascinating and important findings in recent neuroscience. The brain regions responsible for balance, particularly the cerebellum and the basal ganglia, overlap significantly with the regions involved in executive function, attention, and memory. When researchers look at brain scans of older adults with poor balance, they frequently see the same patterns of reduced gray matter density and white matter integrity that appear in the early stages of cognitive decline. Several large longitudinal studies have now confirmed that balance difficulties in older adults can serve as an early warning sign for dementia risk, often appearing years before any memory symptoms become obvious. This means that standing on one leg is, in a very real sense, also a window into the health of your brain. There is also a documented connection between poor balance and metabolic conditions, including type 2 diabetes and insulin resistance. Peripheral neuropathy, a common complication of diabetes that damages the nerves in the feet and legs, directly disrupts proprioception and balance. But even in people without a diabetes diagnosis, higher levels of blood sugar and insulin resistance have been associated with subtly impaired nerve signaling and balance function. This creates a situation where the same lifestyle factors that drive metabolic disease are simultaneously eroding the neurological infrastructure that keeps you stable on your feet. And then there is the connection to muscle mass and bone density that cannot be overstated. After 60, the body loses muscle at an accelerating rate through a process called sarcopenia. Studies suggest that without active intervention, adults can lose between 3 and 5% of their muscle mass per decade after 30, and that rate increases sharply after 65. The muscles most critical for balance, the hip abductors, the gluteus medius, the ankle dorsiflexors, the deep stabilizing muscles of the core, are particularly vulnerable to this age-related loss. As they weaken, balance suffers. And as balance suffers, people move less, which accelerates muscle loss further. It becomes a self-reinforcing cycle that, once it gains momentum, is much harder to reverse than it would have been to prevent. So, what can you actually do? Because that is always the most important question. And the answer is genuinely hopeful. More hopeful than most people expect. Balance is one of the most trainable physical capacities the human body has. Even in people in their 70s, 80s, and beyond, regular balance and strength training has been shown to produce meaningful, measurable improvements in stability, reaction time, muscle strength, and fall risk. The brain retains remarkable plasticity, meaning its ability to rewire and adapt, even late in life. The proprioceptive system responds to challenge. The muscles respond to progressive loading. The nervous system responds to practice. None of these things have an age limit. They simply require consistent, intentional stimulation. Let's start with the most foundational thing you can do, and it's something that costs nothing, requires no equipment, and can be done in your kitchen while you wait for your coffee to brew. Practice the one-leg stand every single day. Not as a test, but as training. Hold onto the counter with 1 or 2 fingers for safety, especially in the beginning, and simply lift 1 foot off the ground. Hold for as long as you can. When you feel steady, try reducing how much you hold on. Eventually, try it with just 1 fingertip touching. Then, for the more advanced version, try it with your eyes closed. Removing vision forces your proprioceptive system to work harder, and that challenge is exactly what drives adaptation and improvement. Research shows that just 4 to 6 weeks of daily balance practice produces statistically significant improvements in stability tests, even in older adults who started with very poor balance. This is not a slow process. The nervous system can begin adapting within days if the right stimulus is applied consistently. Beyond balance-specific practice, strength training is non-negotiable for anyone who wants to maintain their stability and independence into older age. And when I say strength training, I don't mean heavy weights in a gym. I mean targeted, progressive resistance work that focuses on the muscles most critical for balance and mobility. Squats, even shallow ones using a chair for support, are extraordinarily powerful for building the quadriceps, glutes, and hip stabilizers that keep you upright. Chair stands, where you simply stand up from a seated position and sit back down repeatedly, are a form of functional strength training that directly translates to everyday movement. Heel raises, standing on both feet and then rising up onto your toes repeatedly, strengthen the calf muscles and the ankle stabilizers that are crucial for balance. Step-ups using a low step or curb improve unilateral leg strength and challenge balance simultaneously. Side leg lifts while holding onto a counter target the hip abductors, the often neglected muscles of the outer hip that are critical for lateral stability and fall prevention. Yoga and Tai Chi deserve special attention here because the evidence behind both of them for balance improvement in older adults is genuinely impressive. Tai Chi in particular has been studied extensively in fall prevention research. A landmark analysis published in the Journal of the American Geriatric Society found that Tai Chi practice reduced fall risk in older adults by up to 47%. It is one of the most effective interventions ever identified for this population. Tai Chi works by combining slow, deliberate movement with weight shifting, which is essentially balance training in disguised form, alongside breathing practices that improve body awareness and reduce the reactive anxiety that often makes balance problems worse. Many community centers, senior centers, and online platforms offer Tai Chi classes specifically designed for older beginners. If you've never tried it, it may be one of the best things you do for yourself this year. Now let's address something that doesn't get nearly enough attention in conversations about balance and fall risk: the role of medications. Many of the most commonly prescribed drugs in older adults, including blood pressure medications, sleep aids, antihistamines, antidepressants, certain diabetes medications, and pain relievers, have side effects that directly impair balance and increase fall risk. Dizziness is listed as a side effect of dozens of common prescriptions, but it's often dismissed as something minor and tolerable. For a younger person, perhaps it is. For someone over 65 who already has declining balance, dizziness from medication can be the difference between stability and a catastrophic fall. Polypharmacy, the use of multiple medications simultaneously, is extremely common in older adults and compounds this risk significantly. It is absolutely worth asking your doctor to review all of your medications specifically with the question of fall and balance risk in mind. A simple medication adjustment has prevented countless falls and hospitalizations. This is not a conversation to put off. Nutrition also plays a meaningful role in balance health, and it often surprises people to learn how directly what you eat affects your stability on your feet. Vitamin D deficiency is remarkably common in older adults, particularly those who spend limited time outdoors or live in northern climates, and it is directly linked to muscle weakness, impaired proprioception, and increased fall risk. Studies have found that vitamin D supplementation in deficient older adults improves muscle strength and reduces fall frequency, sometimes significantly. Magnesium deficiency, also extremely prevalent in older Americans due to both dietary patterns and certain medications that deplete it, contributes to muscle cramping, weakness, and poor nerve conduction, all of which impair balance. Protein intake becomes more important with age, not less, because aging muscles become less efficient at using protein to build and maintain muscle tissue. Many older adults eat far less protein than their bodies actually need. Adequate hydration is frequently overlooked as well. Even mild dehydration causes a measurable drop in blood pressure when standing, which triggers dizziness and instability, particularly in older adults whose blood pressure regulation is already less responsive than it once was. Here is a myth that deserves to be retired permanently: the idea that becoming less steady, less physically capable, and more prone to falls is simply a natural and inevitable part of aging that you have to accept. This belief, though understandable given how common decline is not supported by the science. What the research actually shows is that a significant portion of what we call aging is actually the accumulated result of decreased physical activity, poor nutrition, medication side effects, and untreated chronic conditions. When these factors are addressed, even in very old adults, the body's capacity for improvement is remarkable. There are people in their 80s and 90s who have rebuilt measurable muscle mass, improved their balance scores dramatically, reduced their fall risk substantially, and regained functional independence they thought was permanently lost. These are not outliers. These are the predictable results of applying the right interventions. The body does not stop responding. We simply have to keep giving it something to respond to. Something that Dr. Selric finds particularly important to emphasize is the psychological dimension of all of this, because it's the piece that often gets left out entirely. Fear of falling is itself a significant risk factor for falling. This sounds paradoxical, but the mechanism is real and well documented. When older adults become afraid of falling, they tend to restrict their movement. They walk less, exercise less, socialize less, and spend more time sitting and stationary. This restriction leads directly to greater muscle loss, reduced proprioceptive stimulation, worsening balance, and ultimately a higher actual risk of falling. The fear creates the very outcome it's trying to prevent. Breaking this cycle requires both physical intervention and a shift in mindset. It requires trusting that your body still has the capacity to improve if you give it the right challenge. It requires taking the first step toward movement even when movement feels uncertain. And sometimes it requires the support of people around you who understand what's happening and why action matters. If you are the adult child or the close friend of someone over 60, this part is for you. The conversation about balance and fall risk is one of the most important conversations you can have with the older people you love. Not in a way that feels patronizing or frightening. Not in a way that implies they are already too far gone to do anything about it. But in a way that says, I found out something important and I want to share it with you because you matter to me and I want you to have every possible advantage. Show them this video. Do the one-leg test together. Make it a shared experience rather than a one-sided intervention. Because one of the greatest gifts you can give someone you love is information that arrives while there is still time to act on it. Let's talk about what a realistic starting plan looks like for someone beginning from a low baseline. Perhaps you tried the test at the beginning of this video and you could barely hold it for 2 or 3 seconds. Maybe you felt unstable immediately. That's okay. That's exactly where many people start. And the distance from 2 seconds to 10 seconds is far shorter than you might think when the right habits are applied consistently. Start with daily balance practice at the kitchen counter. 1 minute on each side every morning. Add chair stands, 5 to 10 repetitions twice a day. These can be done during commercial breaks, before meals, or whenever you have a natural pause in your day. Add heel raises, 10 repetitions twice a day,